If someone told you that dissolving a pinch of pink salt in water before bed was helping their feet stop burning at night, I want you to know that's not entirely wrong. There's a real reason people are trying this, and there's something important you need to understand about why it sometimes works. But there's something even more important that nobody is telling you about what's happening underneath. Stay with me, because what I'm about to share goes much deeper than any home remedy, and it could be the most useful thing you hear today. I've been working with patients over 60 for decades, and I can tell you with complete certainty, the people who try the pink salt trick, the warm soaks, the various home remedies before bed, they're not being foolish. They're desperate. They've been told by their doctors that burning feet at night is just part of getting older, that tingling in the toes is something they'll have to learn to live with, that the numbness creeping up from the feet is manageable with a prescription that makes them dizzy and forgetful, and so they go home. They lie in bed, the burning starts, and they reach for anything that gives them even a few hours of peace. Here's what's actually happening when people use pink salt in water before bed and feel some relief. Pink Himalayan salt contains trace minerals, including magnesium. When dissolved in warm water and consumed, even a small amount of magnesium can mildly relax smooth muscle tissue and temporarily quiet the hyperactive nerve signals that cause that burning sensation. It won't do much, but it does something, and that something is real. What the research is increasingly showing is that magnesium deficiency is one of the most underappreciated drivers of nerve pain in adults over 60. Most people have no idea they're deficient. Their doctor never checked. And the tiny amount in a pinch of pink salt, while not nearly enough to address the underlying problem, is touching a real physiological mechanism. That's why people feel better. Temporarily. But here's what makes this so serious. And I want you to really hear this. That temporary relief is masking a progressive process that continues while you sleep. The burning stops for a few hours, and you wake up and it's back. Maybe a little worse than the night before. Maybe the same. But over months and years, this process moves forward. And that is what I want to talk to you about today. Because you deserve to understand what is actually happening in your body. Not just a quick fix, the real mechanism, and what you can actually do about it. Let me ask you something. When you get into bed at night, is there a moment where things seem almost normal and then the burning starts? Like your feet are fine while you're moving during the day, but the moment you lie down and everything goes quiet, that heat begins to build? Some of my patients describe it as putting their feet near a fireplace that isn't there. Others say it's more like a deep electrical vibration that won't stop. Some nights it's shooting pain, sharp, sudden, like a jolt through the sole of the foot. Other nights it's a steady, relentless burning that makes it impossible to keep the blanket on. Does that sound familiar to you? Because if it does, I want you to know, this is not random. This is not just aging, and this is certainly not something you simply have to endure. I've seen patients walk into my office having been told again and again that what they're experiencing is simply the natural consequence of getting older. One woman, I'll describe her without identifying her, came to me at 69 after 3 years of night burning so severe she had moved to sleeping in a recliner because even the weight of a sheet on her feet was unbearable. She had been to her primary care physician, to a neurologist, to a pain specialist. She had been prescribed gabapentin, which made her so mentally foggy she had stopped driving. She had tried the warm soaks, the compression socks, the home remedies she found online, and she was getting worse. What she didn't know, what nobody had told her, was that the medication she was taking for her blood sugar was actively depleting the one nutrient most critical to the health of her nerves, and that the supplement she had been told to take for her nerves was in a form her body couldn't actually absorb. Think about what that means in daily life. Not just the physical pain, though the physical pain is real and serious. Think about what it means to dread going to bed, to lie there in the dark, exhausted, while your body refuses to let you sleep. People who experience this level of nerve disruption at night often describe a kind of helplessness that goes beyond pain. They feel like their body has turned against them. They stop making plans that involve being on their feet for long periods. They hold onto walls when walking down the hallway to the bathroom at 3 in the morning. Some of my patients have quietly given up activities they loved: walks with a spouse, dancing at family gatherings, gardening in the spring. Not because they were told to, but because the combination of foot pain, numbness, and loss of balance made those things feel too risky. And the loss of those activities is not a small thing. That is quality of life. That is identity. And it goes far beyond burning feet. And here is what concerns me most in clinical practice. When nerve damage progresses untreated, when the underlying deficiencies and mechanisms that are driving it are never addressed, the symptoms do not stay the same. They advance. What begins as burning at night begins to include numbness during the day. What begins as numbness in the toes begins to move upward. Balance problems become more frequent. Falls become more likely. I've seen patients progress from occasional nighttime burning to genuine mobility impairment in the space of 3 to 4 years, while being told at every appointment that they were simply managing their condition. I want you to understand the trajectory. I'm not saying this to frighten you. I'm saying it because understanding the trajectory is the only way to take this seriously before it reaches a point that is much harder to address. The research is clear that peripheral nerve damage, when left without the specific nutritional support the nerve tissue requires, tends to worsen progressively. And the window for meaningful intervention is not unlimited. If what I'm sharing today is new to you, and I suspect it is, make sure you subscribe to this channel. I release critical health information for people over 60 every week. Information your doctor may not have time to share in a routine appointment. Hit the subscribe button below. It costs nothing. And it could be one of the most important health decisions you make today. Now let me explain to you what is actually happening inside your body when you experience nerve burning, tingling, and numbness. Your peripheral nervous system is a vast network of nerve fibers that runs from your spinal cord through every part of your body: your feet, your hands, your legs, your organs. Think of these nerve fibers like insulated electrical cables. Running down each cable is an electrical signal, a message traveling between your brain and your body. The insulation around that cable is called the myelin sheath. It's a fatty layer of protective coating that keeps the electrical signal running clean, fast, and uninterrupted. When the myelin sheath is intact and healthy, signals travel the way they're supposed to. You feel your feet. You know where they are in space. You sense temperature and pressure accurately. You walk with balance and confidence. Now, what happens to an electrical cable when the insulation starts to wear away? The signal leaks. It misfires. It produces interference. Sometimes you get too much signal. That's the burning, the pain, the hypersensitivity to touch. Sometimes you get too little. That's the numbness, the inability to feel temperature or pressure, the loss of balance that comes from not knowing exactly where your feet are. And sometimes the signal comes through distorted. That's the tingling, the electrical jolts, the crawling sensation. All of it is coming from the same underlying process. The insulation is deteriorating, and the question is why. What the research increasingly points to is a combination of factors that converge specifically in adults over 60. The first is a deficiency in methylcobalamin, the active form of vitamin B12, which is the single most critical nutrient for producing and maintaining the myelin sheath. After age 60, the stomach lining produces significantly less of a compound called intrinsic factor, which is required to absorb B12 from food. Many people over 60 are severely B12 deficient without knowing it, because the standard blood tests used in most clinical settings are measuring total B12, not the active form available to nerve tissue. What the data shows is that up to 40% of adults over 60 have insufficient B12 levels for optimal nerve health. And for those taking metformin for blood sugar management, that number climbs substantially higher. because metformin actively blocks the absorption pathway for B12 in the digestive tract. The second factor is oxidative stress, the cumulative damage from decades of metabolic activity that produces free radicals, which attack cell membranes, including the membranes of nerve cells. Your body has natural antioxidant systems to manage this, but those systems require specific compounds that decline with age, including alpha-lipoic acid, which is unique in its ability to neutralize oxidative damage inside the mitochondria of nerve cells. Standard antioxidants cannot reach that location. Alpha-lipoic acid can. And researchers have been studying this compound for decades in the context of peripheral nerve health with consistent and compelling findings. But here's what makes this even more significant, and I'll come back to this in a moment. The third factor is chronic low-grade inflammation, a background fire that runs through the entire body in many adults over 60, particularly those with elevated blood sugar, metabolic syndrome, or long-term nutritional insufficiencies. This systemic inflammation directly attacks peripheral nerve tissue. It disrupts the blood supply to the small vessels that feed the nerves, vessels so fine they are among the first casualties of prolonged metabolic stress, and it accelerates the breakdown of the myelin sheath at a rate that significantly outpaces the body's natural repair capacity. Remember what I said about the pink salt trick? Here's why it only scratches the surface of what's really happening. Magnesium, present in trace amounts in pink salt, does play a role in regulating nerve signal excitability. But nerve pain rooted in myelin deterioration, oxidative damage, and B12 depletion cannot be meaningfully addressed with trace minerals alone. The pink salt trick is touching one small dial on a very large control panel, and the rest of those dials are sitting in the wrong position. Researchers at institutions that have been studying peripheral neuropathy for years have published findings that most people in the medical community have largely moved past without incorporating into routine clinical practice. One area of consistent finding involves the relationship between methylcobalamin specifically, not cyanocobalamin, which is the cheap synthetic form used in most grocery store supplements, and nerve regeneration. Methylcobalamin has been shown in multiple studies to support the repair of damaged myelin and to promote what researchers describe as axonal regeneration, the actual regrowth of nerve fibers that have been compromised. This is not a theoretical mechanism. It has been observed at the cellular level. What makes this clinically significant is that the form of B12 matters enormously. Cyanocobalamin, the form in most inexpensive supplements, does not cross into nerve tissue with the same efficiency. It must be converted by the body, and that conversion process is impaired in a substantial percentage of adults over 60 due to genetic variation. Methylcobalamin bypasses that conversion entirely. It enters nerve tissue directly. The distinction between these two forms is something I wish every person over 60 taking B12 supplements would understand, because most of them are taking the wrong form and wondering why it isn't helping. I had a patient, I'll call him Gerald, 67 years old, retired electrician, came to me after 5 years of burning feet that had progressively worsened to the point where he could no longer sleep through the night. He had been on gabapentin for 2 years. It had helped initially, blunted the pain enough to function, but over time he had needed higher and higher doses, and even then the burning would return around 3 in the morning like clockwork. He was exhausted. He was gaining weight because he had stopped walking. His balance had deteriorated to the point where he didn't feel safe on ladders, which had been part of his work for 40 years. He came to me not expecting much. He told me he had accepted that this was just how the rest of his life would go. What I found when I looked at his full nutritional picture was striking and, unfortunately, predictable. He was profoundly deficient in B12, specifically in the active form. He had been taking a B-complex supplement for 3 years, but it contained cyanocobalamin, which his body was not converting effectively. He was also significantly low in alpha-lipoic acid and magnesium. He had been told nothing about any of this. Within several months of targeted nutritional support using the specific forms of these compounds that actually reach nerve tissue, Gerald reported that the nighttime burning had become significantly less frequent and less intense. He was sleeping through the night more often than not. He described feeling his feet differently, more normally, he said, like something had been turned back on. I tell his story not to suggest that every person will have the same experience, because nerve health is complex and individual. I tell it because it illustrates exactly what happens when the underlying mechanism is finally addressed, rather than simply suppressed. I want to take a moment to talk about what this kind of chronic nerve disruption actually does to a person's life, because I think it is deeply underappreciated, even by the people living through it. The nerve burning at night destroys sleep, and the destruction of sleep is not a minor inconvenience. Chronic sleep deprivation at the level experienced by people with significant nighttime neuropathy has documented effects on mood, cognition, immune function, cardiovascular health, and metabolic regulation. People who have not slept well in months or years describe a kind of baseline exhaustion and emotional flatness that their families often attribute to personality change or depression, when in fact, it is the physiological consequence of a body that cannot rest. I've watched patients become isolated because the combination of pain, fatigue, and fear of falling made social engagement feel more costly than it was worth. They stopped going to family dinners. They declined invitations. They sat on the sidelines of things they had once participated in fully. And that withdrawal compounds the problem, because social engagement is one of the most powerful modulators of pain perception and neurological health that we know of. The autonomy piece is perhaps the most painful. There is a particular generation of Americans over 60 who built their identity around competence and self-sufficiency. They raised families. They worked hard. They managed their own affairs. The idea of needing to hold on to someone's arm to walk across a parking lot, of no longer trusting their own body to carry them safely through an ordinary day, represents a kind of loss that goes very deep. I've sat with patients who cried about this, not because of the pain, but because of what the pain was taking from them, their sense of who they were, their confidence that they still had good years ahead. And I've found, in both the research and in my clinical practice, that when the underlying nutritional and physiological drivers of nerve damage are finally addressed, that confidence begins to come back. Not immediately, not dramatically, but progressively. In the same way the damage accumulated, quietly, over time, the recovery, when supported properly, also moves forward. I've put together a short presentation that goes much deeper into everything I've covered today. It includes specific approaches that I've seen work for patients in exactly this situation. The link is in the description below. Watch it when you have a quiet moment. I think it's going to answer a lot of questions you didn't even know you had. Let me tell you about the specific nutritional compounds that the research consistently points to for supporting peripheral nerve health. The first, and most critical, is methylcobalamin. This is the active, neurologically bioavailable form of vitamin B12. What I've found in both the research and in clinical practice is that this is the single most important deficiency to address in any adult over 60 experiencing nerve symptoms. The research is clear that methylcobalamin plays a direct role in myelin synthesis, the production of that protective insulation layer around nerve fibers. It also supports what researchers describe as nerve regeneration at the cellular level. The distinction between methylcobalamin and the cyanocobalamin found in most grocery store B-complex supplements is not a minor technical detail. It is the difference between a form that reaches nerve tissue and a form that largely does not, particularly in individuals whose conversion pathways are compromised, which represents a substantial percentage of the aging population. For adults over 60, methylcobalamin, in sufficient doses, is the foundation of any meaningful approach to nerve health support. The second compound is alpha-lipoic acid. What makes alpha-lipoic acid unique, and why researchers have focused on it specifically for peripheral nerve support, is that it is one of the only antioxidants capable of neutralizing oxidative damage inside the mitochondria of nerve cells. Most antioxidants work outside the cell membrane. Alpha-lipoic acid penetrates into the mitochondria themselves, where the energy production of the nerve cell occurs and where oxidative stress accumulates, most damaging over decades. Clinical studies have examined alpha-lipoic acid specifically in the context of peripheral nerve support, and the findings have been consistent enough that it is used in clinical settings in several European countries as a standard component of neuropathy support protocols. What most people don't realize is that the body's natural production of alpha-lipoic acid declines significantly with age, which means that by the time someone is 60, 70, or beyond, their nerve cells are running with far less of this critical protective compound than they had in their 40s. The third compound is acetyl L-carnitine. Think of this as the fuel transport system for nerve cell energy production. Acetyl L-carnitine facilitates the movement of fatty acids into the mitochondria, the energy-producing structures inside cells, which gives damaged nerve cells the metabolic resources they need to begin the repair process. Without adequate acetyl L-carnitine, nerve cells that are trying to recover from damage are operating at an energy deficit. They can't run the repair machinery efficiently. Researchers have studied acetyl L-carnitine extensively in clinical settings as a support compound for peripheral nerve health, and the consistent finding is that it works synergistically with alpha-lipoic acid, each compound supporting a different aspect of the same recovery process. What's also notable is that acetyl L-carnitine has documented effects on nerve growth factor, a protein the body uses to signal and support nerve repair. This is not a supplement that simply blunts pain. It is working at the level of nerve cell biology. Benfotiamine, the fat-soluble form of vitamin B1, deserves specific mention for anyone with elevated blood sugar or a history of diabetes. Standard thiamine, water-soluble, does not penetrate nerve tissue with significant efficiency. Benfotiamine, being fat-soluble, crosses cell membranes and reaches the interior of nerve cells in ways that regular thiamine cannot. It has been studied in European clinical settings for decades specifically for its role in protecting nerve tissue from glucose-related damage, the mechanism by which chronically elevated blood sugar, even at the pre-diabetic level, causes progressive deterioration of peripheral nerves. For a population where blood sugar dysregulation is extraordinarily common, even in people who have never been diagnosed as diabetic, benfotiamine represents a targeted and well-researched form of nutritional protection. Now, you may be wondering why, if these compounds have this kind of research behind them, your doctor has never mentioned them. I want to be honest with you about this. It is not a conspiracy. It is a system problem. The medical education system in the United States trains physicians to diagnose and prescribe. Nutritional biochemistry, the specific forms of specific nutrients that reach specific tissues, receives very little attention in medical school curricula. Most physicians are doing the best they can with the tools they were trained to use, but those tools are primarily pharmaceutical. When a patient comes in with nerve pain, the training says, prescribe gabapentin, prescribe pregabalin, manage the pain. And those medications do suppress pain signals by broadly dampening neural activity throughout the nervous system. What they do not do is address the underlying mechanisms driving nerve damage. And what the research increasingly suggests is that they may, over time, interfere with the very signaling processes that nerve tissue uses in its natural recovery capacity. The system is not designed to flag the fact that a patient on metformin has been silently depleting their B12 for years. It is not designed to identify that the B12 supplement a patient has been taking for years contains cyanocobalamin in a dose insufficient to address the deficiency, in a form their body cannot efficiently convert. It is not designed to evaluate the cumulative nutritional picture that is driving the biological conditions underlying the patient's nerve symptoms. And the result, which I have watched play out across decades of clinical practice, is that millions of people over 60 are suffering from something that has a meaningful, research-supported nutritional dimension that never gets addressed. That is not acceptable. And it is the reason I continue doing what I do. You are not powerless here. I want you to hear that clearly. Your body, even now, even after years of symptoms, has a remarkable capacity to respond when given the specific support it has been lacking. The peripheral nervous system is not static. It is not simply decaying. Given the right nutritional environment, given the specific compounds that support myelin maintenance, that neutralize oxidative damage inside nerve cells, that restore the energy infrastructure of damaged nerve tissue, the research suggests that meaningful recovery is possible, not overnight, not as a guarantee, but as a genuine biological possibility that millions of people are never given the chance to pursue because nobody told them about it. And the next time you reach for the pink salt water before bed, or whatever has been giving you some temporary relief, I want you to remember what I shared today. Now you understand what's actually happening. You understand the myelin, the B12 deficiency, the oxidative damage that alpha-lipoic acid reaches and nothing else does. You understand why the temporary relief is temporary, and you understand what addressing the real mechanism actually looks like. That knowledge belongs to you now. Use it. If today's video opened your eyes to something important, share it with someone you care about, because there are millions of people over 60 dealing with this silently, and they don't have to. The short presentation in the description goes even deeper. I highly recommend watching it when you have a quiet moment. Subscribe for more critical health information every week, and leave a comment below. What was the most surprising thing you learned today? I read every single one.